Good afternoon, everybody, and welcome to the latest in our Share and Learn series. This is the fourth episode in our third series of Share and Learn, where we share updates and good practice on the work happening within the Nottingham City Place-Based Partnership. If you ever wanted to catch up on any of the previous episodes, you can do that on our YouTube channel. We always record these sessions so that you can watch at your leisure. This afternoon, I'm delighted to be joined by Jules Seblin, who's the Chief Executive of Nottingham Community Voluntary Service, and Amanda Chambers, who's the Programme Manager for the Green Space Social Prescribing Programme. Like usual, we're going to have a presentation from Jules and Amanda that will last about 20 minutes. And today the focus is going to be on working with the voluntary community and social enterprise sector. So we'll have a presentation of about 20 minutes, and then we'll have about 10 minutes left at the end for questions. So throughout the presentation, have a look up in your chat and Q&A boxes at the top of the screen. And please remember to post your questions for them so I can post them at the end of their presentation. So without further ado, I think I'm going to pass over to Jules, who's then going to introduce Amanda. So Jules, over to you.
Thank you very much, Rich, and hello everyone. It's really fabulous to be back here again doing a share and learn session, but today I'm going to make my colleague Amanda do most of the work actually. So I just thought I'd set the scene a little bit. Amanda's going to talk largely about our Green Social Prescribing program, but because it's a live program at the moment, we're getting a lot of learning, and we believe that learning will be very well transferable across all of the voluntary sector. And Green Space is one of 7 test and learn sites across the country, but we're one of the few that's actually led by the voluntary sector, and we're quite excited about the learning that we're getting from that. So, well, I won't keep boring you any longer with me. I'll hand you over to Amanda, and she'll tell you all about what we're doing, and happy to take questions at the end.
Thanks, Jules. Thanks for that introduction, and hello, everybody. As Jules said, I'm going to be talking about green space, so working with voluntary and community sector in the context of green social prescribing, because that gives us a very live, active, happening now experience, and sharing that learning that we're hearing every day as we work through the Green Social Prescribing programme. Now, I'm sure some of you may have heard me talk about this before, and just really briefly, we're one of 7 test and learn sites across the country that are exploring what needs to be done in order to embed green social prescribing into social prescribing. And much of the learning, much of the actions that we're taking around the green part of social prescribing applies across that wider social prescribing system, but also that learning of how we bring together health and voluntary sector, how we develop some really good partnerships, really good engagement, so that we deliver fantastic outcomes. Could I have the next slide, please, Daniel? So just thinking about the value of working with voluntary and community sector, and I'm sure you could all point to examples when you may have done that, or you might even be a volunteer yourself and work in that sector, or be involved in a voluntary and community sector organisation. Thinking about green social prescribing, our focus is very much about mental health, and we know there's a real need, and some of the things on those slides are pointing out what that need is. We have a priority around mental health within our ICS to shape and transform our services and our interventions, so they really and better respond to the mental health and care needs of the population. We know that mental health is driving a significant number of referrals to social prescribing linked workers, but also to other healthcare professionals. We work closely with Frameworks Nature in Mind service, which work with people with more serious and complex needs, and they get multiple referrals from multiple referrers. So the demand is there, the demand is high, the problem is there. And the evidence talks to us about the fact that people with high nature connectedness really have positive benefits if they connect into nature. On the right hand side of that slide, there's some benefits there, and some of you may have experienced some of those yourself. So that our voluntary sector are delivering these benefits every single day. Every time somebody is interacting with them, engaging with them, volunteering for them, taking part in their activities, linking into the work they're doing, they are potentially realising one or more of these benefits. And these benefits haven't just been plucked out of the air. They've been researched there's a book that's been developed that I'll share with you at the end of the session by Natural England and by the University of Derby that really looks at those benefits of nature connectedness. So really valuing that voluntary and community sector as benefit deliverers, and they can deliver those benefits and they can have a real positive impact on everybody's health and well-being. Next slide, please, Daniel. So the learning we've got from working with the green and the nature-based providers, and really this applies across working with the voluntary sector in any context, but I'm going to focus on the green and the nature-based providers. I mentioned volunteers a few times now. Those providers out there are heavily dependent on a volunteer workforce. So what does that mean? It means that those number of volunteers can go up and down. It can mean that they're not working 9 to 5 like we tend to do, working Monday to Friday. So they're working evenings, they're working weekends. So when we're talking to them, interacting, engaging, we have to think outside our normal working hours. We have to think about their different skill sets when they do have volunteers, perhaps when they're struggling with volunteers, which might impact on the delivery that they can offer. And the other thing is volunteers are not a free resource. So for our voluntary sector who are working with volunteers, they have to look after those, they have to coordinate them. We work to support the voluntary sector to have really good volunteering, good practice, good guidelines on how they work with volunteers. And that doesn't come free. So don't associate the word free with volunteers. If volunteering is to be done well, then it needs to be well resourced and well supported. So how they work is very different to how perhaps we might work in a professional and an office environment. Thinking about that voluntary sector, they come in all different shapes and sizes. And for some of the smaller providers, designing, developing, funding, delivering, and then evaluating their activities, it's a considerable task to them. So thinking about when we're asking them to develop activities, when we're asking them to evaluate those activities for us, how can we help them do that? They might be 1 or 2 women bands. They might not have an evaluation expert. They might not have digital competence. They might not have resources where they find it easy to do all of those tasks. Their focus will be on what they do well with people. So thinking about when we ask them to design things, thinking about when we ask them to evaluate activities, how can we help them do that? How can we make it easy for them to do that? How can we support? How can we make it clear? How do we not make it too difficult for them to do it? Particularly around evaluation. Clearly we need evidence that what's happening out there is working, but how do we do it in a way that is friendly to that voluntary sector, that potentially helps build their capability around this area? So understanding that it might be the same person that's designing, that's developing, that's chasing funding, that's doing the evaluation, and is also delivering an activity. So just understanding how they work and how we can step into that space and work with them really helps develop that relationship. Many organisations have real challenges around funding, and that's not new. And there's so many organisations out there that rely on short-term, low value and unpredictable funding streams. And that is a constant worry to them, and it's a constant task for them to be chasing funding. So if we are thinking about funding voluntary sector, putting funding into these organisations, can we make it less unpredictable? Can we think about longer term funding? Can we think about how we approach funding in a different way? Jules and I've been using the word funding, and I can see Jules looking looking at me, and we said we're going to have a ban on the word funding. We want to call it investment, because investment's a much better word. It's much more of a relationship word rather than a transactional word. So how do we invest in these organisations that can provide all these fantastic outcomes for us? How do we invest in a more intelligent, in a more robust, in a more sustainable way? Now, that's not going to happen overnight, but it is important that we think about that, because it is very difficult for organisations to be constantly going from hand to mouth and chasing that short-termism and those funding streams. We've discovered when we've gone out there and spoken to green and nature-based providers that actually they're very willing to get involved and wanting to get involved, but there's a worry there, there's a concern there. Are they going to be able to deal with an increase in people accessing their services? Are they going to be getting a lot of referrals through from health, but there's no funding following that? Have they got the right skill set? So we've worked hard with our providers to understand them, understand what their capacity and their capability is. Where can we invest in those organisations in terms of perhaps training, in upskilling? So an example of that is with Green Social Prescribing, we're focusing on mental health. So we have provided fairly simple mental health awareness training to help build the confidence and the skill set of those green providers so they feel happy and willing and in the right place to accept those referrals. But we've also done is giving them information by working in partnership with the Mental Health Trust on where they go if they have an issue. If they have a problem with a patient or a service user that needs some support or help, or they have an episode or an incident on their site, who do they need to call? Where can they get instant help? And providing that information and providing that support around a little bit of training puts that organisation in a great place to feel confident that they've got the right capability in order to work with those service users. So all different sizes, all different levels, different capacity, and really understanding that is important in working with the voluntary sector. And thinking that, okay, if you want to work with the voluntary sector and you're looking for a particular provider to address a particular issue, provide a particular service, maybe there isn't one out there. Maybe it's a consortium approach that might work. Maybe it's bringing together a group of smaller providers who between them can provide a great offer. So they can't all do everything, but they can all together provide what you need. So consortium approach is great. They can share resources, they can work together, and they can give you a varied offer. So rather than perhaps always going where you've always gone, perhaps think differently and think how maybe a consortium or a collective approach could work. We're trying to build this, for example, in different areas that work in the city. So in September, we're bringing together a whole range of green providers to the Borwell Forest Garden site. And we're bringing in our local link workers and other health referrers to meet each other, to understand that across Borwell, there's 4, 5, 6 different green providers. And between them, they can potentially offer a solution. They can offer a referral route. They can offer an activity that meets the needs of those healthcare staff when they're working with patients and they're going through the what matters to you conversation. So consortiums and providers coming together can be a great solution. Can I have the next slide, please? So that kind of leads me into those relationships and the importance of relationships between health professionals and providers. Moving away from a transactional into more of a relationship. And through Green Space, we're really trying to nurture those relationships. So making introductions, encouraging our local health referrers, our link workers, our mental health professionals to actually go and visit and experience and try out what the voluntary sector providers have to offer and build those relationships. And we know when we have a social prescribing link worker, for example, that has a great relationship with a local green provider, the referrals come. and that relationship builds and develops, and it's positive for all parts of the system. When that link worker maybe moves on, what we see is the referrals suddenly stop because that relationship is broken down. So how do we build those relationships? Those relationships are so important. So what we do is try and encourage that and nurture that. And one of the best ways is absolutely going and visiting and experiencing and trying it out so that you get a really good understanding of actually what that voluntary sector can provide, that provider can provide, but also maybe some of the challenges they have, understand how they work, understand where their quiet times are, when their busy times are, and how they're right and how they can work with you. So thinking about relationships rather than transactions, and as well going beyond that. So as well as trying it out and linking and engaging, actually encouraging co-design and co-producing around what matters, those what matter to me conversations that health professionals will be having with patients and service users. So co-designing something, coming together, going to the voluntary sector provider and saying, look, this is what we're hearing from our patients. This is what matters to them. This is how what they would like to do in their local community. How can we work together with patients, with deliverers, as health professionals to co-design that and co-produce that? Because if you do that together, and where we've done that together, we know it's much more likely to be successful for all parts of the system. And I think another important issue is don't assume that those providers out there know that you exist, that they understand what an ICS is, what a place-based partnership is. I've been working in green social prescribing since last April, and I still sit in meetings with Google on so that I can Google when I'm with health colleagues, so I can understand sometimes what they're talking about. And I found over the months that I've been working in this that my knowledge has grown and my understanding has increased, but that's because I'm exposed to it every day. So don't assume that they know that you're there. Don't assume that they know how to connect with you. And a really good example of this is when we started working with a lot of green providers, particularly around social prescribing, they said to us, what's this social prescribing? I've heard about it, but it's like a locked gate that I can't get through and I don't have the key for it. And once we described and explained what it was sort of, oh, right, yeah, well, we've kind of been doing that for years. We've been working in that way and saying, yeah, it's a description of something that's come along. And once we started explaining about link workers, then absolutely that understanding grows. But don't assume because they're there that they know about you. And equally, we mustn't assume that you will know about all of those providers that are out there as well. So part of what we've been doing is really trying to bridge that gap so that there is those opportunities to build those relationships. So yes, don't assume that they know who you are and what you're doing and what you're trying to achieve, and the priorities that we have in health. Could I have the next slide, please? So those are just some of the things that we've learned along the way in terms of how we're working with the voluntary sector, and they apply across voluntary sector, not just for green social prescribing. And one of the solutions, one of the things that we came up with was our green space trusted providers. And this was a solution and a way of working with those providers, with that voluntary sector. When we spoke to referrers across the health system, particularly link workers, there was a real concern about who they're referring their patients into and wanting to know that they were making effective and efficient referrals, that it was safe, that they were going to get a warm welcome, and that it was appropriate to that patient's particular needs. And then speaking to the voluntary sector, there was concern on their part about whether they would be the right place, would they be overwhelmed, have they got the right skill level, who would be coming to them. So the trusted provider is a way of trying to overcome that, so that we work with our local providers to understand our voluntary sector, what they can provide, what their capability is, what their capacity is, and then we share that with our referrers so that they have a good understanding of each other. So a referrer can know that if they're a trusted provider, they've got the right policies and procedures in place so that their patient is going to be safe and well looked after, but also that the activity is right for them and that the provider feels confident in receiving the referrals. So something like a trusted provider scheme, it's not a formal accreditation, but it's a confidence building framework, for want of a better word. It's a confidence building framework that builds confidence in both sides of that referral system to hopefully ensure that a patient has a positive experience. And also that framework really helps build that confidence with those providers. It helps them talk about what they can do. It helps them develop what they can do. And as a trusted provider, they can come to us and say, well, actually, we've been doing this for a while. We'd like to expand what our offer is. We'd like to develop it. We'd like to increase our skill level. So that's been a really, really useful tool that's come out of those discussions with both the providers and also the referrers. Go to the next slide, please. And just my final two slides. As part of the Trusted Providers scheme, we prepared something called mental health levels, which we developed with the Healthcare Trust. And this is specifically linked to mental health, but it could be applied across a range of different ways that you're working with voluntary sector. Providers were very keen that they didn't have referrals from patients that they were not equipped to work with. So using the pathways that the Mental Health Trust has developed, we developed these different levels. And so we might have a provider who's comfortable working at level 0 and level 1, which is at the lower end of mental health issues and need. And then we have other providers who are more comfortable at working at level 3, where there's a greater need of expertise involved. And for the voluntary sector provider, being able to say, yeah, we're really happy at level 1, but with a bit of support, we could move to level 2. As a CVS, we can then go in and we can work with them to help develop their capability to move them up to level 2. So the Trusted Provider Scheme and the mental health levels, although specific to green social prescribing, are really good examples of frameworks that can be put in place, that can be developed between the different parts of the system, that can help build the relationship, that can help build confidence, and that can help deliver really effective, efficient outcomes for patients in a safe way, so that people know where they are, they know where they're going, and they know what the offer is and that it's appropriate and effective. And so it is a way of helping of putting a framework around some of that relationship building and moving from very much a transactional to that relationship focus. And if I could have my last slide, please. Here's some useful resources and links that you might, if you want to know more about green social prescribing and the work that we do as a CVS and how we can support you as an NCVS in terms of that relationship with that voluntary sector. We've got some green space web pages. You might find those useful just to see what we're doing, but also if you are looking at moving people into green social prescribing or referring them in, that might be of interest to you. We have a Facebook page, you can follow us, and we have a green space e-bulletin that goes out monthly if you'd like to sign up there. If you want a really good example of partnership working and working really well with voluntary sector and health coming together, then watch this video. It's all about Highbury Hospital and the community garden there, and the work that we've been doing with green social prescribing with working age dementia peer group, with the team in the garden, with the staff on site at Highbury Hospital coming together and working and having a really good example of how that relationship can work. And finally, there's a link there just to the Nature Connection handbook that I mentioned earlier, which is a fantastic resource, really easy to access and just makes the case for Nature Connection. But it's a really good example of the value of the voluntary sector out there and being able to deliver significant health and wellbeing outcomes for our residents. I'm going to finish there and hand back to Jules, who hopefully will give a little wrap up there and talk maybe a little bit about how NCVS can help with that relationship building.
Yeah, absolutely. I know we need to leave some time for questions as well. I don't know, Rich, do we have some questions for us, which we're happy to take? And but yeah,
sure.
get in touch with NCVS. We're really pleased with the way this is all evolving, and we're involved in wider programs as well. So yeah, happy to have that conversation with anyone outside of this forum.
Thanks, Jules, and thanks, Amanda, for really interesting presentation. Fascinating, the learning that you get from that program and how you apply that across other programs and across our system, really. Particularly interesting insights around working with the voluntary sector. So we've only got 5 minutes left. We've got a couple of questions, and the first one is, what do you think the main advantages are of programs being led by the voluntary sector?
Well, that's good. That's a very good question. Do you want to start, and I'll chip in?
Okay. One of the things that we've heard from when we've been working with local communities is they really like things being delivered that are hyper local, that are delivered in their community by people that they see every day, by potentially their people they know, that makes it easy for them to get to and easy for them to access, and gives them a sense of community. And those activities are mainly delivered by that voluntary sector, those voluntary sector organisations. So I think that's a key thing, that stuff that's really hyper local, that's delivered by people who are from their local community, that real sense of being able to get involved and be part of that. So I think that is one big benefit. The other benefit, I think, is something I mentioned about all the different shapes, sizes, capacities. So we go from providers that are just one person, one woman band, up to bigger providers that are out there that might be like a community football trust, for example, that are out there that are delivering. So, and within that, you've got lots of different sizes. So there's something that will suit everybody. Some people will feel more comfortable going to a small organisation, others will want to go to bigger ones. So I think they're 2 key benefits for me as to why that voluntary sector. And the third one, I suppose, and Jules will probably say this, is because they will be driven by wanting to do good for people. That's why they're there. They will probably, in a lot of cases, have come about because there's a problem or an issue, or they've seen something that they believe in, that they feel they can improve and do something that's good for their local community. So they're coming from a really good place, and they're not being driven by perhaps a profit or a business motive. So they're 3 off the top of my head.
And I think the other thing about this program being led by the voluntary sector is that we had those connections and relationships. So our test and learn site probably got up and running and delivering activities far sooner than some of the sites that didn't already have those connections on the ground.
That's great. Thank you both. Okay, we've got 2 minutes left. I think, can we just focus on, Amanda, during your presentation, you talked about consortiums of voluntary sector organisations and the work that NCVS does to support voluntary sector organisations to bring together consortiums. How do you think that other partners can support voluntary sector organisations to bring together consortiums to have that wider offer?
I think it's about having a different mindset. Often when organisations out there want to put something out there to be commissioned or to be funded, it goes out as a competitive bid. And what you find happen in a place, so I don't know, let's pick St Anne's, for example, you might get 4, and I've seen this happen, 4 or 5 different organisations bidding in a competitive way for that particular bit of investment or funding or programme. Actually, if you took a consortium approach to it, where those 5 organisations actually together could have a better offer between them, where they all benefited from in terms of their organisations, but they're coming together, and the offer they can provide can be more wide-reaching, can reach more different parts of the community. So maybe it's about how things are put out there in a different way, so that that consortium approach is encouraged rather than a competitive approach. And there is examples of that. So if you look at something like the National Academy of Social Prescribing Thriving Communities work, they deliberately put that out as a consortium approach, where they were looking for consortiums to come together, to work together. And that consortium had to reflect the local population or the target audience, and also encourage some of those service users to be part of that consortium. So it starts with whoever is almost putting that work out there, that project out there, and taking a different mindset to it, rather than putting something out to be competitive.
And the kind of support we can offer is kind of that pivot point where that work can flow through. So it's about not having to have 20 different relationships if 20 providers are in the consortium, but having that pivotal point of gathering so that you're bringing the right providers together. So NCVS can help facilitate that kind of approach.
That's brilliant. That's brilliant. Thank you both. Great answer. So we're just about out of time now. So if anybody has any follow-up questions, I know we can probably get in with Amanda and Jules. I'm sure they'd love to hear from you. But we need to wrap up today. We've got one more episode of our Share and Learn series, which is an update on the community transformation work that's happening in the Bulwell and Top Valley primary care network. I think we were scheduled to have that in September. I think that's been put back until October now, so keep an eye on our Twitter, our social media, for an update on that. But until then, thank you, Amanda, thank you, Jules, and thank you everyone for watching today, and see you next time.